Can having babies decrease your risk of having a heart attack? Stick around to find out because your favorite nurse practitioner is going to break it down for you. But first, hello everyone, my name is Ray and I'm a hospital-based nurse practitioner who specializes in cardiovascular disease. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we like to talk about heart disease, both prevention and treatment, other topics related to the heart, and overall health and wellness. So if that sounds good to you, let's get started. All right, so here's a little bit of a spoiler alert. The title of this video and the intro were just part of the equation that we'll be discussing today because here's the rest of the story. If you want yet another good reason to breastfeed your babies, here it is. It can actually make you live longer. You heard that right. You see, heart disease is the #1 killer of both men and women, yes, even more than breast cancer, and we now know that breastfeeding your babies can reduce your risk of having a heart attack. Now, I'm primarily going to be talking to the women in this video, but fellas, before you dip out on this video, this information is good for you as well, and I actually have a call to action for you, so stick around to make sure you don't miss it. Now, we've known for years all the benefits to the baby, like reduced risk of numerous acute conditions like reduced ear infections, respiratory infections, GI infections, and even chronic conditions as well, such as asthma, allergic rhinitis, atopic dermatitis, obesity, type 1 and type 2 diabetes, inflammatory bowel disease, childhood leukemia, all kinds of chronic conditions as well. But we've even identified an association with breastfed children having improved cognitive development and higher intelligence scores. So if you want to have smarter children, you got to try to give them the milk. But if those reasons weren't enough for you, here are some other reasons to consider breastfeeding your children. According to the American Journal of Obstetrics and Gynecology, longer lactation duration is associated with a lower risk of ischemic heart disease, which means having a heart attack, in women with evidence showing a risk of reduction of 18 to 37% of those breastfeeding greater than 2 years compared to never breastfeeding. So multiple large prospective studies demonstrate this cardioprotective effect. In the Nurses' Health Study of 89,326 women, those who breastfed for a lifetime total of greater than or equal to 2 years had a 23% lower risk of coronary heart disease after adjusting for lifestyle factors. According to a meta-analysis of 8 studies by the American Heart Association, which involved 1,192,700 women, found that ever breastfeeding was associated with a 14% lower risk of coronary heart disease compared to never breastfeeding. The China Kadoorie Biobank study of 289,573 women showed that breastfeeding for greater than or equal to 2 years was associated with an 18% lower risk of coronary artery disease. The protective effect appears to be dose-dependent, with each additional 6 months of breastfeeding per child being associated with a 4% lower risk of coronary artery disease in Chinese women. Among women with type 2 diabetes or gestational diabetes, which are populations that are particularly high cardiovascular risk, breastfeeding greater than 18 months versus 0 months was associated with a 32 to 51% lower cardiovascular disease risk. So practically cutting your heart disease risk almost in half. The proposed mechanisms include lactation's favorable effects on maternal metabolism, with breastfeeding women demonstrating lower fasting glucose, triglycerides, insulin resistance, and blood pressure. Additionally, sustained reduction of subclinical inflammation has been observed years after breastfeeding, with lower C-reactive protein, or CRP levels, persisting 5 years postpartum in women who exclusively breastfed for greater than 3 months. By the way, CRP is a biomarker of inflammation and tissue damage. We see this simple blood test in the hospital a lot. It's one of the most requested, ordered tests in clinical laboratories. So now, besides lowering your risk of heart disease, breastfeeding also confers maternal health benefits, including reduced cancer risk, specifically breast and ovarian cancers. Breastfeeding also has metabolic benefits such as reduced risk of type 2 diabetes, especially after gestational diabetes. For those of you who don't know, having gestational diabetes dramatically increases your risk of developing type 2 diabetes in your lifetime. Breastfeeding also reduces your risk of metabolic syndrome and non-alcoholic fatty liver disease. By the way, metabolic syndrome is a cluster of cardiometabolic risk factors, which include abdominal obesity, atherogenic dyslipidemia, which includes elevated triglycerides, and low HDL, which is your good cholesterol, your happy cholesterol, elevated blood pressure, and elevated fasting glucose. If you have 3 out of the 5 of the above, you'd rule in for having metabolic syndrome. And if you have metabolic syndrome, you have a 2-fold increased risk of cardiovascular disease. Breastfeeding is also associated with improved body composition, lower body mass index, lower body fat percentage, and lower visceral adipose tissue. I personally saw this with my wife after she had our kids. She lost weight incredibly fast and actually went below her pre-pregnancy weight. Breastfeeding helps with postpartum recovery. As you could probably imagine, having a baby is very taxing and demanding on the body. And breastfeeding helps you get back to your pre-pregnancy state sooner rather than later, like I mentioned with my wife. And fellas, I promise you that some of this information will benefit you as well. Many women experience body image problems after giving birth, and getting back to their pre-pregnancy figure is of top priority. So as their partner in life, you can help by encouraging breastfeeding and helping out in whichever way you can. For example, if she has to pump and needs you to help her, either by bringing her the equipment or simple things like putting the expressed milk into the freezer containers for her and then helping her rinse out the equipment so she can get a little bit of rest. These little acts of service will hopefully help her get through these tough times when she's considering, giving up, because it's very exhausting. She just manufactured a human, or humans if you're having multiples, inside her for 9 months or so, and so it takes a big toll on her body, not to mention the lack of sleep that, practically all new parents usually experience. Breastfeeding also helps with lower hypertension risk, and this was particularly seen during middle age, so women between the ages of 40 and 49, and those are going to be high-risk patients. So again, fellas, if you want to keep her around for a long time, make sure you help her in whatever ways you can. According to an article in the journal Lancet, at a population level, optimal breastfeeding is thought to prevent an estimated 823,000 child deaths and 20,000 breast cancer deaths annually worldwide. It's estimated that the unrealized benefits of inadequate breastfeeding represents about a $341 billion per year, that's billion with a B, in annual global losses. So what's the key takeaway? Ladies, please consider breastfeeding your babies. It's great for you, it's great for your baby, and it's great for the world. Now, I know this isn't an easy thing for all women, and if you're struggling, please consider seeing a lactation specialist. Believe it or not, there are people out there who are specialists that can help you navigate through any barriers that you may have with breastfeeding, so you don't have to go at it alone. And again, fellas, try your best to be involved. Yes, she needs you to be her provider, but she also needs your presence and understanding. I had to learn this the hard way, and after 21 years of marriage, this is still something that I'm working on, but trust me when I say this, and I believe most women would say this, they would rather live in a smaller house, drive an older car, and live a simple life if it meant they had more time with their partner. I'm not entirely sure how I went from breastfeeding to a bit of marriage advice, but I think I'll close this video out now. If you've made it this far, I want to thank you for spending your time with me. Time is one of our most precious gifts we can give, and it's finite, so thank you for sharing yours with me today. If you have any questions about this or any video, please feel free to leave me a comment. I read and answer them all, and I look forward to an engaging community. If you found this video to be helpful or informative, please let YouTube know by subscribing to the channel, and make sure you turn on your notifications so you'll never miss when I upload a new video. I want to say a big, huge thank you to all of the current subscribers, all 408 of you. Y'all are really motivating me to continue to do this work and make this content that helps others. Please consider sharing this with the people you love in your life. I think together we can decrease the burden of heart disease one video at a time. While you're here, I'd love for you to check out some of my other videos, like what Big Pharma doesn't want you to know about diabetes. I have a video about hormone replacement therapy and how it impacts heart disease. I recently uploaded a video about sleep and how it can impact your risk of developing heart disease. And I also have a video about how to count calories and how to get started with intermittent fasting. So make sure you go check those out too. I hope to see you again in the next video. God bless you.